Hello everybody, welcome to this short presentation on the reasons why your loved one with dementia might not eat well. So we saw earlier on that dementia can have an impact on nutrition. So the person with dementia may experience an altered sense of taste and smell because of their dementia. Their ability to interpret sensations such as hunger, thirst and fullness may well be reduced or lost over time, especially as the dementia progresses. And we've seen that distraction and not understanding that food is to be eaten may also impair nutrition. A person, of course, may lose their appetite or indeed start overeating. So it's really important then that we look at the topic of nutrition and look at some of the reasons why a person with dementia might not eat well. And there are a number of these, and some are directly related to dementia and some are generic factors. So let's look at some of the dementia factors first. So dementia can lead to diminished motor skills, and this depends on the type of dementia and the stage of dementia. So diminished motor skills can have an impact on your loved one's ability to recognize utensils, eating utensils, or in fact their ability to use those utensils. Constipation and depression can also affect appetite. So depression and apathy is one of the side effects or symptoms indeed of dementia, and that can have an impact on appetite. And just ordinary constipation, of course, can also affect appetite. So watch out for that. Side effects of medication are also prone to affect appetite, depending on the medication, of course. So if you think that might be a factor, it'd be a good idea to check that with your GP or doctor. Other kind of more benign reasons could include dental discomfort. So having a dry mouth or ill-fitting dentures can affect somebody's ability to chew and therefore to eat food. And a person sensing impatience in you, the carer, can also impact on their eating habits. So just be careful about that. As we saw last week, the non-verbal communication skills and non-verbal communication methods are really important when looking after somebody with dementia. Other reasons why somebody might not eat well could include the environment, and having a noisy environment, a distracting environment with competing noises, and maybe even having too much food on the plate could be a factor. So just watch out for that. Over time, there can be changes in the person with dementia's sense of taste. Exercise and fresh air is important in terms of having an appetite. So if the person is not getting outside and getting fresh air or getting enough exercise, that can impact on their appetite and may be a factor in them not eating well. On the other side, fatigue, not sleeping, can make people tired, and therefore they may not be able to eat a full meal as it's too tiring. Sensory impairments are also important. So poor eyesight or hearing can affect general mood and also ability to eat. And because we see and taste food with our eyes and our nose before we eat, so sensory impairments can affect appetite. Other reasons for poor appetite or causes of poor appetite could include cognitive problems. So, as I just mentioned earlier, the person mightn't recognize food or drinks or cutlery, and concentration during meal times could be problematic. Physical problems with swallowing can also be a factor. So again, we mentioned dentures, and this can be an issue if they don't fit and they affect the person's ability to chew or swallow. Holding onto a glass or knives and forks again can be a problem, as we mentioned earlier. And responsive behaviours can manifest themselves at mealtime. So again, as we mentioned last week, it's a good idea to try and figure out the reasons why somebody is behaving aggressively. And if you could try to use the ABC model to isolate the issues that might be causing responsive behaviours, that could also help with improving diet and appetite. What else might help? Well, prompting and gentle encouraging with favourite foods is important. Try to eat with the person so he or she can see what you're doing and copy what you're doing. Try keeping a diary or notes of what is being eaten in terms of what's popular and what the person with dementia has no problems eating. And use meaningful activities to distract from overeating. So we're going to look at this topic of engaging activities in the next topic, so we'll return to that a little bit later. Okay, that's the end of this short presentation. Thanks very much for watching and listening.